Hello everyone. Today we're going to talk about insulin order sets and changes. These changes occurred in December 2016, specifically December 7th, and they're slightly different from what you're familiar with, so we're going to go over these. First thing you need to go over is hypoglycemia. We're used to our patients having hypoglycemia, how to take a look at them and what to do with them. There's a few subtle changes with the hypoglycemia protocol. Number one, we're used to if the patient's blood glucose is less than 70 milligrams per deciliter, we give 4 ounces of juice or 8 ounces of milk, which are essentially 15 grams of carbs, which is what you find out in the real world. 15 grams of carbs, recheck glucose in 15 minutes. However, here's the change. If the blood glucose is less than 50, then you actually give more. They want you to give 30 grams of carbs, which is 8 ounces of juice or 16 ounces of milk. Please refer to Appendix B that's in your folder. Okay, in Appendix B, you'll notice there's an algorithm here. They want you to recheck your glucose in 15 minutes. Okay, if you recheck the glucose in 15 minutes and it's greater than 70 milligrams per deciliter, check and see when the next meal is ordered. If it's going to come in more than an hour, they want you to give the patient a snack of 15 grams of carbs. And you're going to continue to monitor this patient every 2 hours times 3. If the blood glucose is less than 70, they want you to hang a bag of D5W at 42 mils an hour and notify the house officer. If the patient's not eating and they have an IV, again, the same sort of algorithm applies. If the blood glucose is less than 70 but greater than 50 milligrams per deciliter, they want you to give 12.5 grams of D50 IV push. If it's less than 50, you're going to give double that, 25 grams of D50, so it's essentially 50 mils IV push. Again, just like with the oral protocol, you check the blood glucose in 15 minutes and then go from there. If the patient does not have IV access and they're not able to eat, you give them 1 ml of glucagon IM stat, get IV access, and check the blood glucose in 15 minutes. This did not change from the previous protocol. So as a reminder, you will have 3 types of orders generally, not always. And, if you have someone who's type 2 diabetic, they might just have correctional orders. Someone who's type 1 diabetic, they'll have basal orders and nutritional orders generally. So what does it really mean? So basal orders, remember, it gives long-term insulin. So it's like NPH and glargine, you get 1 dose a day. It mimics normal circulating insulin. Nutritional orders are orders of short-acting insulin that are meant to combat or help get glucose into the cells after a meal. And then correctional orders are meant to correct normal or increase glucose levels from other things like being hospitalized, okay? So basal insulin, like I mentioned, given once a day. Nutritional insulin, you only give nutritional insulin if they've eaten 50% of their carbs. So you have to visualize the tray beforehand and the tray after. It's combined with correctional insulin and it's given immediately after the meal. Okay? This requires that the person who's taking care of this patient does 2 things. One, they need a blood glucose just before the meal or within an hour before the meal, and they visualize the tray. Correctional insulin is based on the finger stick just prior to the meal. So a correctional scale, here's an example we have at Hopkins. Low dose, medium dose, high dose. You don't get to pick which sliding scale they're on. It'll be based on how responsive they are to the insulin. Obviously, if your patient keeps getting 6 units of insulin and they're on the low dose sliding scale, they're going to move them up to the medium dose scale. But You'll notice the first column is the blood glucose before the meal, and then it tells you how many units they get. There are some changes with basal insulin. Um, like I mentioned before, it simulates normal circulating insulin, and pH and glargine are the drugs that you'll give. And it has a long period of action, which you need to know the duration of these drugs. Where it's a little different is that now they're recommending that nurses can call the provider under certain conditions. If the patient's NPO, if they're eating poorly, or if they have hypoglycemia, have the provider consider a 40% reduction of the basal dose. For those patients not on nutritional insulin, you can give correctional insulin at the start of the meal. So not all patients will be on nutritional insulin. So here's a new thing. You'll take the blood glucose just before the meal and you'll just give the correctional insulin with the meal. And they recommend at the start of the meal. And bedtime insulin and hypoglycemia, if the blood glucose is less than 100, they recommend that you give a 15-gram carbohydrate snack and recheck in 2 hours. And you really should notify the house officer. So let's practice. So if a patient gets 10 units of glargine and they have nutritional units, 4 units of aspartame, they eat half of their carbs, and their blood glucose is 200 just before the meal, how much insulin do they get in total? Well, they'll get 10 units of glargine, and then you give the nutritional and the correctional insulin immediately after the meal, so they will get a total of 6 units of aspartame after the meal. Let's say in the morning they have a basal insulin of 10 units of glargine, and then correctionally they have a blood glucose of 200, but they don't have nutritional insulin, and they're eating a meal. They would get the 2 units at the start of the meal. And let's consider someone has basal insulin of 10 units of glargine, correctional insulin, finger stick just prior to breakfast, and their blood glucose is 222 and their NPO. So they would get no nutritional insulin if it was ordered. They would get correctional insulin. They would get 3 units, and the nurse would contact the provider, see if they can get a 40% reduction in the glargine. So you would be hoping to give 6 units of glargine instead of the 10. You notice that we didn't hold it because they still need that insulin, but you contact the provider to ask to reduce the glargine amount. So I hope this makes sense. Other factors to consider, remember you have a peak effect. So realize that especially with short-acting insulin, you cannot continue to dose someone on insulin. You have to wait until the next meal or until the next blood glucose is ordered before you actually give insulin. So it's really important to know when the last dose was, really when the peak onset of these drugs are, especially the short-acting ones, because these drugs will continue to work. So be wary of that. So when do you report hypoglycemia? Well, you do report any hypoglycemia, but here's the key. You treat it first. Treat the patient, make sure they're okay, and then you can let the team know. Anytime you give D50, glucagon, or start dextrose infusion, you'll also let the team know right away. Okay, so timing is everything. Let's consider the orders. Okay, person's normally ordered 10 units of glargine sub-Q every morning. Nutritionally, they get 4 units of aspartame insulin sub-Q after each meal, and then correctional insulin as the low-dose algorithm. This person is NPO for surgery in the morning. At 7 a.m., their blood glucose is 65. What do you do? Well, We know this patient still needs their long-term insulin, which is glargine. So you'll get a 40% reduction of glargine and you give it, so it's 6 units. Additionally, they're hypoglycemic. So you have to give, and their NPO, they have to get 12.5 grams of D50 and check a finger stick in 15 minutes. So we give the D50, and then in 15 minutes their blood glucose is 275. Do you treat again? The answer is no. Okay? You really want to realize that that glargine is now on board and it's going to be circulating. Okay? Instead, since it's greater than 70, you're going to continue to check their blood glucose every 2 hours for three more intervals instead. Okay? So don't treat the number, treat the patient, and know that the duration, the peak of what's going on. Okay? I hope this was helpful. Have a great day.